I'm Dr. Katarzyna Trebska. I'm a breast surgeon in Ironwood Women's Center in Gilbert. Today, I would like to talk to you about high-risk breast cancer and risk reduction strategies. Breast cancer is the most common malignancy diagnosed in American women. 1 in every 8 women will be diagnosed with breast cancer during their lifetime. Most commonly, breast cancer is attributed to female gender and aging. But there are certain known risk factors that can be attributed to developing breast cancer. It is important to identify those risk factors because then we can take actions to prevent cancer from developing. There are some genetic factors that predispose patients to developing breast cancer, such as BRCA1 and 2 mutations, Li-Fraumeni syndrome, and other mutations such as PTEN, CDH1, and others. It is important to know that most familial cancers are not determined by known genetic mutations, and only 1 in 10 cancers is actually caused by genetic abnormality. There are many models based on population study that can estimate risk of developing breast cancer for a particular woman. Those models take into account factors such as age, ethnicity, family history of breast cancer, age at menarche, age at first birth, personal history of breast biopsies, and what those biopsies showed. Increased body mass index is a known risk factor for developing breast cancer, especially in Caucasian women. History of personal radiation to the chest is also a risk factor for future breast cancer. Knowing that someone is at the increased risk of developing breast cancer in comparison to general population will let us implement more aggressive screening program, or we can undertake risk reduction strategies to prevent cancer from developing. In women who are known carriers of a high-risk genetic mutation, performing prophylactic mastectomies might be an option to prevent breast cancer. Another strategy to reduce risk of developing breast cancer include lifestyle modifications, such as consuming less than 1 alcoholic drink a day, maintaining healthy weight, and enrolling in the exercise program. If a woman is known to be at a higher risk of developing breast cancer in comparison to general population, it is very important for her to establish a relationship with a breast surgeon, who will be able to implement more aggressive screening program as well as guide her through the risk reduction strategies. If you have any questions or would like to have a risk assessment performed, please come and see me in Ironwood Women's Center in Gilbert. Also, feel free to check other videos on our website.